I'm Dr. Kiran. I'm an orthopedic and spine surgeon with a recent qualification in rheumatology. What I'm going to speak to you today about the disc. This is my 22 years experience. My observations, literature reference, article reference. Who is Kilkardy Willis? Stop here. Go and search. You have to know about them a little, just a glance, so that you have an idea about what all they did. Kilkardy Willis Degenerative cascade. They say there is always a age group. They have classified. I'm going to show each table, each slide which I put in this speech. You pause, you check it out, understand, and then only move on in this lecture. So what they said was, this is like a tripod. The disc and the facets are like a tripod. What is a tripod? Tripod is like a stand. This is the disc. These are two the facets. So whatever happens here, it just revolves like that and affects this. So never see a disc degeneration as something, a singular incident. No, there's something going on. 360 degrees of degenerative changes are taking place. This is what I want to emphasize. Kilkardy Willis degenerative cascade starts with some kind of a dysfunction. This dysfunction is stage 1. During stage 1, there will be some changes in the disc, and also when there is some pressure changes, they irritate the posterior facet joints or zygopophyseal joints. So there will be some swelling, some collection of fluid, synovitis, irritation, and then it may resolve or progress to the next stage of instability. Now, instability which I am saying, I am not talking about something like this. I am not talking about a spine going like this. No, inner instability. Concentric fibrils of the annulus fibrosis. They will have initially concentric tear, then there will be a radial tear like this, and then the disc will bulge. This instability is then followed finally by a disc bulge, protrusion, extrusion, sequestration, and finally it goes to stage 3 of stabilization. Like there will be excess bone formation. There will be total narrowing of, I created a disc. I'm going to remove. I just made a disc out of some spare material which I had, just to represent it. Then what happens? The stage 3 is stabilization. It has, the disc is totally degenerated, and then osteophytes, like a bridge, from this to here. It forms, and the whole movement is lost. There is no more movement because the pivot is lost. And then it leads to lot of arthritis here, and it may have pain because the patient, depending on their occupation, they'll have some symptoms. You need to have a pivot on which it can bend forward, bend backward, bend sideward. All these things are possible because of the, so much of athletes, everybody, jumping, swimming, whatever you do, horse riding, dancing, because these discs are allowing it to have this movement. When I said that this annulus fibrosis has layers of collagen and other material, and these fibers are, one goes clockwise, other goes anti-clockwise. These layers are around 10 to 12. The purpose, to give the resistance to various kinds of stresses, flexion, extension, torsions, shearing, stress, all these things, vertical compression, all these things they bear. When they degenerate and develop small cracks, that is where they give way. And the semi-solid or semi-fibrous nucleus pulposus, which is in the center, may just and it come out like this. Bulge, a protrusion, an extrusion, and a sequestration when it is cut and the loose pieces lying down. One more important aspect is, when we talk about a vertebral segment here, disc has come out like this. It can go down caudally or it can go up cranially. It depends on the position when the disc came out. So these are all interesting things because, why? When somebody is doing a surgery, just removing a disc and coming out, what about if it is there up or down? You have to consider where, to what extent it has gone down. Then the way we do the surgery also changes. Now, one more thing is, as long as the disc is there, normal disc, the patient, suppose is a 6-footer, he maintains his height. But after a certain age, as the disc becomes thin. I'm removing the disc. That is the loss of disc height. What happens? It's coming down. Person, even asymptomatic, no symptoms. He will lose his height. He's no more 6-footer. Earth, it will bring us down by its gravity and natural degenerative process by doing so much of work every day where we do all these kinds of movements. Okay, that's why posture was one of the episodes I was concentrating. Pulposus is the central part and it contains 66 to 86% of water, which dries after 10-15 years. Now the other constituents are type 2 collagen. This type 2 collagen is different from type 1 collagen. Type 2 collagen is flexible. Type 1 collagen is more like a bone. So the outer layers of the annulus are made of type 1 collagen because they are nearing to the attachment of the end plates, right? The inner layer of annulus fibrosus contains type 2, which is the same also in the nucleus pulposus. But when it comes to the periphery, it needs more rigidity, bone-like rigidity. So it gets hardened. These soft fibers blend into hard fibers. Does the disc cover the whole of this undersurface between the vertebrae? No. Around 2 mm before the margin, they end by attaching again with collagen fibrils, and then you have a ring and all is contained within so that they don't spill over. Now, vertebral end plate. What is vertebral end plate? Like I said, it does not extend to the edges. It is limited and it ends where the ring apophysis limits the disc material and the end plate. Ring apophysis. What is apophysis? Can you answer me? You have iliac apophysis, right? What is riser's sign in the pelvis to see skeletal maturity? Now one question to all the medical students or orthopedic surgeons or ortho spine, neurospine, young students or young doctors. I would like to ask you, does the disc migrate? What happens is, physiologically, when there is load bearing, the disc does migrate. If I am doing like this, it migrates to the other side. When I am doing like this, it migrates to this side. Similarly, when I do a forward compression, it migrates back. So always there is a propensity when you do a flexion job, all these agricultural farm workers or laborers or us sitting in wrong positions, there is always a propensity of forward compression, especially in certain parts of the spine where the disc is always loaded. This is my annulus and this is the nucleus pulposus. It's always hitting. See, just watch. It's being pushed. So it's pushed. So gradually there will be pressure changes and we don't know all these things. You may ask, doctor, why don't we know all these things initially? Yeah, because disc is essentially aneural, avascular. Aneural means no pain. Unless the outer layers which are having these vascular and nerve fibers supply are irritated, then everything starts getting more painful. And once there is an inflammatory process, these nerve endings start migrating into the inner surface also, inner layers also. And there is a change. What happens is, when you are doing like this, slowly it breaks, it starts giving problems. And to face this, the body will compensate. How? The type 1 collagen at the periphery, which is hard, like I told you, now it goes inside. The type 2 collagen in the annulus fibrosus becomes type 1. That soft, flexible part converts into type 1. Also the disc, there will be changes. No more the flexible collagen will be there. So all these are body's reparative process. Like somebody hits me. Somebody hit me like this. I immediately catch. That's my reflex. Immediately stop. Hand. This is what is a body's defense mechanism. How it reacts. You will all read about it later. But I want you to read it now as a student. Maybe you'll have beautiful ideas and maybe you will innovate or invent a beautiful thing. There are many viewpoints on this. Do we do a fusion after discectomy? If there's a big chunk of disc that has come out like this big chunk of disc when you remove, suppose surgically, I have gone through a microscope and removed this. Good. This was the compression on the spinal cord. My finger is the spinal cord or the nerve root. Now I have removed it. So there is no compression. Everything is free. My spinal cord is like this. See, it was previously like this. Spinal cord is getting compressed. Now I removed it. My spinal cord is free. Exactly. But what happens? There's another problem. When you remove totally disc, there is no support. No, this disc is there. The big disc has been removed. Okay, I removed the disc surgically. For example, this much a big disc. What happens? You lost its support. There's another condition. It can be your short notes in your exams. Post-discectomy syndrome. Because there is no support. It has fallen down. Once this is the situation, before surgery, you have given relief. Patient is happy. But after 3-4 years or 5-6 years, he comes back again for a surgery. The pain is so huge. Almost 8/10, 9/10 because it's compressed. The nerve root has been compressed. By now, the nerve has become chronically thickened. So the diameter of the nerve has also increased. Also the diameter of this neurovertebral foramen may be decreased by osteophytes. The secondary changes, also changes in the facet joints. The facets become hypertrophied. They become big. Kilkardy Willis Degeneration cascade also involves the vertebral body blood supply to be disrupted. Presence of type 1, type 2 or type 3 modic changes in the vertebral end plates convey even after surgery, pain may continue. This must be told to the patient. Why? To avoid legal problems later. That is why now research is being done to reduce this KW degenerative cascade by introduction of stem cells, synthetic materials. With age, the degeneration will continue with whatever you do. But let's hope that we do something great for our patients. Tomorrow we never know. One of you may come up with a nice project like this, an artificial disc. Where, yes, artificial discs have been invented and they are designed and they are used in cervical spine, even in the lumbar spine. The normal criticism is you will do it, the patient is happy, but afterwards it becomes like a fusion, it doesn't work. My dear students and young orthopedic surgeons, I leave a message after this lecture involving you. At every stage, at every slide, halt. There is no hurry in learning because your learning must be permanent. You should understand and then proceed. Stop at one slide. Suppose modic changes, you don't know about it. Nothing wrong. Knowledge is such an ocean. Not everybody can know everything. It took me 22 years to come up with this upload. So it's not easy. And I have been working on this. If you observe in this video, there will be variations in the audio, variations in the video, which itself convey. I did it multiple times. I had to edit. My eyes are burning. It's not easy. It is not easy. Nothing is easy in life, my friends. So if you want to win, work hard. Please subscribe to Video Teacher 2 Medico so that your queries can come to me and I can respond in time with you. It takes time. You have to balance life. Good luck. Bye-bye.